So, move this up slightly. I'm going to welcome you to what is the not-for-profit version of the movie Groundhog Day. So, with Groundhog Day, every day we replay the day before, and we're stuck in this loop where we struggle to change the narrative. But unlike a movie, ours is not a romantic comedy, it's more of a tragedy. Each day we wake up in an environment where we provide vital services to the citizens of the state of New York. And in many cases, we act as a surrogate for the state, providing mandated services. We do this knowing that we are being grossly underpaid for the services that we provide, and in some cases reimbursed at 85 cents on the dollar. We care for the state's elderly, their children, we house the state's homeless, we support the state's mentally ill, we treat the state and aid the state's infirm. We wake up every day pondering how are we going to remain vital and continue to do so in the absence of adequate support from our partners, some of our partners in state government. We ask how do we cover the increasing costs of rent, utilities, food, insurance, and most important, labor. And how do you do that when the funding from the state is flat year after year after year? So like in the movie, we know how this is going to end. We wake up every day and we know what the ending is going to be, but it's not the ending that we want. So we work desperately every day to try to figure out what we can do today to influence a different outcome. We add our voice today to 360 now organizations around the state. So this is our news conference, but there are news conferences all over the state where not-for-profits similar to the group that is convened here are coming together to ask the governor to fund the critical needs of our sector. And specifically, we're asking for support to first fully fund our contracts. And in doing so, to also make sure that there's an adequate amount to cover what we refer to as indirect costs. So we're asking for at least 15%, minimum, 15% to cover the indirect costs. And what does the indirect costs cover? It keeps the lights on. It pays the insurance. It pays the rent for the buildings that you occupy. So it's critically important. And that's been totally flat for years and years. Next, we ask that they address the issue as it relates to our staffing. Many of my colleagues have a staff attrition rate, turnover rate of about 35%. Each year, 35% of our employees leave. It's very, it costs us a lot of money to replace them, but more importantly is the impact that it has on our clients. Individuals who have difficulty making those connections, they develop relationships with people, and those people are constantly churning. So we've asked the state to start by doing something I think is sort of very basic, and I assumed was going to happen when we fought for the fight for 15. We assumed that when the minimum wage was raised, that the state would provide us with the funding to cover the increases. They did not. So we're asking them to fund that. We're also indicating and asking that the state take responsibility for making sure that our workforce is paid at a decent wage. We really should be being compensated at the same level as state employees who do the very same work that we do, and in the private sector. But the reality is that our staff historically has been grossly underpaid. And then we're asking that they cover the issues associated with our infrastructure. So whether it's IT, replacing roofs, heating and cooling repairs, replacing our elevators, major plumbing repairs, the list goes on and on and on. And the reality is that we wake up every day understanding that these issues exist, but we defer it because we don't have the resources, and we're always looking for ways to provide the funding to take care of it. So unlike the movie, we are going to ensure the outcome. And this today is the first effort to make sure that the state understands it is critically important for them to do the right thing and to make sure that we have the resources necessary to do this work. So with that, I want to turn it over to Allison Sesso. Allison is the Executive Director of Human Services Council.